James, and this is a presentation on swimmer's ear, more technically known as otitis externa, and this is for my nursing course 5372 at the University of Texas El Paso. So what is swimmer's ear? Swimmer's ear is the inflammation of the external ear canal. It's usually caused by a bacterial infection, and it can also involve the pinna, the tragus, or the lymph nodes. The two most common pathogens that cause swimmer's ear are Pseudomonas or Staphylococcus. Swimmer's ear tends to occur in children over the age of 2. It usually occurs in older children and adults who are exposed to lots of water and moisture, and it tends to happen more in the summer months rather than the winter months because obviously in the summer months we're more in lakes and pools and getting a lot more sweat, and so there's a lot more moisture that has a tendency to build up. So what causes swimmer's ear? It can be caused from moisture and humidity becoming trapped in the ear canal. And the reason it's called swimmer's ear is because obviously when you're swimming in water, it's going to trap moisture and water into your ear, which can cause inflammation and infection in the actual ear canal. Swimmer's ear can also be caused from trauma of the ear canal, from Q-tips, anything like that. You know, kids, they'll stick a pencil or anything like in their ear. Anything that's traumatic in the ear canal can cause otitis externa, as well as too much earwax, and actually keeping your ear too clean can also cause it because it actually regulates the pH of the ear, and so if the pH is off, many times you can get an infection. Signs and symptoms of swimmer's ear are usually pain at the ear. Sometimes you can have a decrease in hearing. There can be some itching and drainage, as well as just feeling a general pressure in the ear. If it is severe, many times people can run fever. And in children who maybe not be able to vocalize that they're having pain, you're going to see them tugging and pulling on their ear a lot. On physical examination, whenever you're actually examining the person's ear, there may be some pain whenever you're actually pulling on the ear. You're going to see some swelling, redness, and narrowing of the ear canal when you actually visualize with an otoscope, and then you may also see some drainage present in the ear. Treatment of swimmer's ear varies depending on the signs and symptoms. Most cases are treated with some type of an antibiotic ear drop. The fluoroquinolone is the first line of antibiotic treatment. If symptoms such as a fever or extreme pain occur, you may also need to treat those symptoms. Some of the common antibiotic drops used are cortisporins, ofloxacin, ciprofloxacin, dexamethasone, and gentamicin. It is always recommended that the drops be given at least 3 days past the cessation of any symptoms that the patient is experiencing. Side effects of topical antibiotic drops include irritation at the actual administration site, itching, they may have some dizziness or vertigo, as well as just a generalized earache, and occasionally you may have a rash develop, especially if there's an allergic reaction. Oral antibiotics are very rarely used, but should be considered in cases where the swimmer's ear or otitis externa is consistent or the infection is also in the middle ear canal. Side effects of oral antibiotics include GI discomfort, nausea and diarrhea, and sometimes an allergic reaction. If you have a specific antibiotic, you should really see the information on the specific drug for the most common side effects. The analgesics that you may use for pain or fever would include Tylenol, NSAIDs, or possibly opioids for extreme pain. Tylenol, as we all know, should be used with caution in patients who have GI disease or use anticoagulants. Obviously, if you're giving a specific medication, you need to refer to that specific medication for the side effects. So obviously the best thing with any type of disease that we can do is obviously prevent it. So different things that you can do to prevent swimmer's ear or after you get done swimming is to always tilt your head and kind of shake out any excess water that's in your ear. You can also use a hairdryer on a very low setting. Always switch it from really hot to cold and just kind of absorb that extra moisture that's in your ear. After swimming, you can also squirt 2 to 3 drops of acetic acid in the ear. You want to avoid swimming in dirty water, so lakes and rivers. If you do wear a hearing aid, you want to take it out often to help absorb all that moisture so that it doesn't get stuck behind there and get trapped in the ear canal. And you also want to avoid sticking anything in your ear. We all use Q-tips, but to be honest, it's really something that no one really needs to use. In order to monitor if our preventions have been effective, we want to educate families and parents about the different things that they can do to prevent swimmer's ear. And our goal as healthcare providers is for the children susceptible to swimmer's ear to get less infections because they're performing these preventative measures. Informational handouts and videos should always be given to the family. As healthcare providers, we also want to promote good health. So it's always a great idea for local clinics and hospitals to hold health fairs and seminars in the summer months to educate parents on preventative measures for swimmer's ear. Having education materials at local pools and aquatic centers should also be available.
Hi, my name is Melissa, and now we're going to be to the part where we demonstrate actually how to administer the ear drops for swimmer's ear. So the first thing that you want to do with either your child or your teenager or your adult is you want to have them lay down on their side with the ear up that you're wanting to put the ear drops in. You want to first wash your hands really good with soap and water, and if you have a child under the age of 2, it's a good idea to get them to wash their hands as well, because we all know that they like to tug on their ears. So you get your ear drops, you want to mix them in your hands really well because you want them to warm up, because if they're cold, a lot of times you can cause the patient to get real dizzy or have some vertigo. So you want to warm them up real well. You want to take your top off, and you want to be careful when you take the top off to not actually expose the top or touch it on anything, because then it becomes contaminated. So if you have an adult or a child who's over the age of 3, you're actually going to pull up and back on the top of the ear, and then you're going to place however many drops you need. Usually it's 1 to 3, just depending on manufacturer's guidelines. And then if it's a child, you're actually going to pull down on the earlobe and out. And your goal is to be able to expose the ear canal. So depending on the age, depends on what you have to do in order to actually be able to expose the ear canal. So once you're done, you want to have your patient lay there for at least 2 minutes so the medication can actually get down and absorb into the ear canal. You can put a cotton swab or a tissue whenever they sit up, just to kind of absorb up any of the excess. You want to put the top back on, and then you want to store it according to regulations, usually just at room temperature. If you do have a child that's under the age of 2, it's a good idea to swaddle them, because a lot of times it's hard. They're going to want to move and do things and touch their ears. So if you actually take a blanket and swaddle the child, it's a lot easier to control. And like I said, on the child, you're going to pull down instead of up. So thank you very much for your time.